I'm looking forward to my first dance.
Just hours ago, John Furtado was in the operating room for a total knee replacement.
I've been told that I should expect some of the worst pain I've ever had in my life, and at this moment I feel zero pain.
John is not taking narcotics. Instead, just before he woke up from anesthesia, Dr. Scott Sigman injected a new medication called Exparel into his knee. The FDA approved the drug in 2011 to treat post-surgical pain.
The patient doesn't even know you're doing it. They're asleep during the operation.
Dr. Sigman says Exparel acts like a form of lidocaine, creating numbness in the tissue for 24 to 72 hours. That's typically when pain from surgery is at its worst.
It's a true innovation in how I'm treating my patients.
Jacob Metzler is one of them. Dr. Sigman fixed his dislocated shoulder, but not without a lot of encouragement.
I purposely did not want to get surgery done because I was afraid that they were going to give me opiates afterwards.
Jacob is a recovering drug user, more anxious about painkillers than the pain itself.
I was very determined to stay clean. I didn't care how bad it hurt.
Dr. Sigman agreed. Jacob is at high risk for relapse if he ever takes narcotics again.
The nice thing about this Exparel medication was that it provided a 24 to 72-hour window, getting him through the worst of that pain so that he was then able to take standard anti-inflammatory medication without requiring narcotic.
And now Jacob remains on the road to recovery for both his shoulder and his addiction.
I'm doing awesome. I have a new job. I have a new truck. I have a beautiful girlfriend.
For Dr. Sigman, it's evidence that surgeons can do more to prevent opioid addiction after operations.
The best way to deal with substance abuse is to prevent it in the first place.
Back in the recovery room,
So on a scale of, 1 to 10, what do you think?
with his left knee wrapped, John Furtado says he's resting comfortably.
If I can get by with a Tylenol, I'll be quite happy.
Dr. Sigman says he feels so strongly about the benefits of Exparel after surgeries, he's now a consultant for the manufacturer. Emily Reamer, WCVB News Center 5.